had 7 seconds to tap in on item number 15, and I missed it. I was busy making notes. Probably like to be recorded and voting no. Let me just give you the 4 minutes of summation. You just passed $9 million of taxpayers' money, $500,000 matching, on programs that are questionable. Just read this morning's paper on eliminating medical tests that are no benefit. Some procedures can do patients more harm than good. I've been probably saying this for 20 years. Perfect example, in these 12 projects is bioterrorism. They have that. I wrote a paper on that in graduate school, that there's no known cases of bioterrorism successful in this country. There's one in Japan with a chemical that killed people. But we're throwing hundreds of thousands of dollars, millions of dollars towards that. Good example is we're spending $100,000, whether it's state money or federal money, on leprosy. Hansen's disease is leprosy. You went down 12 of these and you don't even know what they're doing. But I'm just wondering if we need, how many cases do you know of leprosy in the city of Houston? Immunization branch, $1,500,000 that we're throwing towards that. We went from children with 3 shots as a child, very vulnerable age to the nervous system, to 33 shots. Some of them are still experimental. The flu, you're putting hundreds of thousands of dollars against the flu. It transmits differently every year. You cannot have a flu shot every year adapted to the mutated flu. And when somebody gets the flu from a flu shot, well, they should have followed up flu shot. It is inexact science that you're throwing millions of dollars towards. STD, HIV. There's a section in there, that $1.6 million, for surveillance. Why are we surveillance people with HIV? West Nile, there's too much of a scare on that. We've spent millions of dollars in the city, county, state, and federal for a disease with flu-like symptoms. There are more people that die from the seasonal flu than there are from West Nile virus. But they get the scare tactics going on a disease. The disease mongers get it. People make money off of it. The swine flu. Read the report from the first swine flu. Fiasco was the description, the federal government's report. $1 billion in taxpayers' lawsuits on that vaccination, and yet they brought it back up, and more people had the regular flu than they had the swine flu, the scare tactics used there. Diphtheria, I think the Bush administration put $8 billion aside because of the scare on that. So just be cautious. The $3 billion cancer fund that we voted in, it says the word prevention in there. Senator Nelson made that word go in there. You look at these contracts, there's nothing about prevention of cancer. So you passed 12 projects. Just be careful on how we're spending taxpayers' money. There's one program in there on, let me read it to you before the bell rings, and you tell me what it's for. Funding of DSHS and HHS to develop objectives to address public health issues, provide service to conduct activity service to support essential public health services, assess, monitor, evaluate essential public health activities, develop strategies to improve the delivery of essential public health service. $300,000. What in the heck are they going to do? You know, I'll tell you what, for $300,000, I'll teach kids to exercise, eat right, proper rest, and they'll be healthier than that paragraph there for $300,000. So just be careful of it. I'm sorry. I get on that, and we just spent $9 million of city, state, and federal money. And what are we getting for it? Just think about it. Sorry.